pleased to be joined by Lana Jackson again, Dr. Lana Jackson, who is a senior clinical psychologist, yoga therapist for mental health and mindfulness teacher. And Lana specialises in working with children and adolescents with mental health issues and in paediatric psychology. So welcome, Lana. Thanks for coming back for part two.
That's okay. It's lovely to be here.
So we're going to talk about EMDR again. And when we spoke recently, you mentioned that you attended an EMDR conference and you went to a workshop on walking EMDR. So could you say a bit more about how that works?
Yeah, so I was really excited by this workshop. So the workshop was run by an amazing lady called Lorraine Tyndale, and she has been doing some research, but also some work with veterans who have really quite disabling PTSD. And for that kind of client group, they were really sort of struggling to actually even be sort of in a room with a therapist in an enclosed space. And maybe find it harder to access things online. And so she's got a real sort of personal sort of passion for walking, and she's walked the Camino Way. So she sort of has developed this sort of protocol for sort of taking EMDR outdoors. So she'll meet with the veterans in sort of a natural setting like woodland, and actually go through the process of EMDR, the sort of protocol, structured EMDR protocol, but in an outdoor natural environment. And she's getting some really lovely feedback, and it's kind of, it's really inspiring. And I suppose if you kind of think about it, as we sort of walk, we sort of naturally actually kind of create some bilateral stimulation in the body. And it's interesting because Francine Shapiro, who was the sort of person that kind of developed EMDR, she actually sort of discovered EMDR when she was out walking. So she, I think she'd been through some quite difficult experiences with cancer, and she had been going out walking, and she'd noticed that when she kind of thought about some of the difficult experiences she'd had, that her eyes would sort of naturally sort of go from side to side and sort of scanning the environment. And she became really interested in this process, like what might be happening, because she sort of felt better when she was out walking with these difficult feelings. And so that's how EMDR was sort of discovered. So it's interesting that we've sort of taken it into the therapy room, and now people are sort of interested in taking it outdoors. And I wonder whether, there's sort of a mechanism there. Sort of, we are sort of natural beings. We've kind of evolved walking long distances, I think. And so it kind of would make sense that there might be this sort of inbuilt natural mechanism there that supports us in processing and dealing with traumatic events.
Yeah, and obviously you are a yoga therapist. We're not going to talk about that now, but you're interested in ecotherapy as well. So could you just talk about, and it's relevant to what you've just said about walking EMDR, but the benefits of taking therapy outdoors?
Yeah, I suppose, again, at this point in time, there's a kind of big interest in this area of taking our therapy outdoors because of COVID as well. A lot of therapists are struggling to meet with their clients face-to-face without the full PPE. So actually the outdoor environment kind of is a way of sort of having a sort of more authentic human-to-human encounter, but in a safe sort of outdoor, socially distanced way. So it's kind of like a growing area of interest currently due to COVID, but also the last sort of 20-30 years there's been a real strong movement in what we call eco psychology, which is looking at the relationship between human and the planet, the earth, nature, and looking at how our kind of disconnection with nature in our sort of modern lives actually may be causing a lot of the mental and physical health issues that we struggle with as humans, but also in relation to that, sort of some of the difficulties that we're seeing with climate change and environmental destruction. And this whole body of therapy that is now kind of developing in momentum is what we call ecotherapy. It's kind of an umbrella term for lots of different kinds of ways of taking people out into nature and helping them, I think, really connect back to their sort of natural environments or their natural landscapes. So you might see sort of projects in the communities where you have like allotments and sort of horticultural sort of therapy, right the way through to therapists or psychologists like myself, who are sort of taking their work outdoors and kind of doing their sort of therapeutic work, but they're sort of doing it in an outdoor setting. I could probably say more about that.
Have you had a chance to, with COVID, have you actually been taking clients, meeting them face to face outdoors?
Yeah, so I've had a few clients that I have done that with, and I think there's sort of huge benefits to actually sort of being in an outdoor environment or setting for our mental health anyway. So actually kind of meeting people outdoors, you can see that people often sort of talk about sort of just feeling sort of much more open, relaxed, curious. And there's some really nice theories now. The attention restoration theory is quite an interesting theory about how when we're in an indoor environment, we're kind of really often sort of really focused on and our attention is sort of quite filled with lots of different things that we need to do and different ways of communicating. And then when we step in an outdoor environment, we have this sort of more open, curious kind of what they call soft fascination with what's around us in the open environment. And I believe that being in an outdoor environment also really promotes mindfulness and a kind of present, curious, maybe appreciative awareness of the things that are around us. And you see that with children when they're outdoors. They're really curious and they're exploring and they become more playful and in the moment. And I think that's a really sort of supportive thing for a lot of people who are struggling with mental health issues. And another benefit as well is the sort of physical activity and movement. So we know that particularly for people with mental health issues, there's lots of research on the benefits of exercise. So we now know that, yeah, kind of having regular exercise or being outdoors regularly does support our well-being. And I think particularly for people who've experienced trauma, often when they've been in that traumatic sort of situation, it's been a situation where they haven't been able to escape or they haven't been able to move. And that might be physically, but it might also be in a mental way, that they're quite sort of, they've been stuck and frightened. And so when we experience sort of adrenaline and cortisol, the sort of stress hormones that are going, we're quite distressed. Actually, one of the best things that we can do is move that, because our body and our nervous system that wants us to move. It wants us to kind of move with that experience. So I think movement and being outdoors can really promote that sort of healing for people that have experienced trauma.
Right. Very fascinating, Lana. Thanks very much for that. So
That's okay.
yeah, it's been great and really informative to do both of those interviews. So thanks, Lana.
Thank you. Thanks for having me.
Yeah. Bye.
Bye.